Good morning. I'm Peter Kovacs. I'm the editor of The Advocate and the Times-Picayune, and welcome to our town hall with Governor John Bell Edwards. Governor, thank you for being here.
Peter, good to be with you. Thank you.
Our town hall today is brought to you by AARP, and we'll start with a brief message from them.
Hello. AARP Louisiana would like to thank the Advocate for this timely and important conversation with Governor Edwards. We would also like to thank the Governor for his leadership during these challenging times. I'm Bobby Southlaw, AARP Louisiana State President. AARP is a nonprofit, nonpartisan member organization that has been working to promote the health and well-being of older Americans for more than 60 years. Over the past several months, AARP has hosted numerous teletown halls with several thousands of our members to share important resources and information on how to stay safe and protect themselves and their loved ones during the COVID-19 pandemic. While we are all grateful that 2020 is in the rearview mirror, COVID, of course, is still with us and will be for some time. But 2021 does hold the promise of broad vaccine distribution across the country. It is a critical time to remain vigilant and follow the advice of the Governor of Louisiana. Stay safe, Louisiana, and remember to be considerate of others. Continue to wear your face coverings. Wash your hands often. Keep your distance from others. Stay home if you're sick. And let's all get vaccinated. Together, we will get through this.
Welcome back, and thank you. Governor, a lot has happened since last time we got together, and I know one thing that happened is that you got vaccinated. So is it Pfizer, Moderna, right arm, left arm? Did you have any reaction? How did that all go?
Well, I'll get my second shot next Tuesday, but it was Pfizer, and it was administered in my left arm, and quite frankly, had absolutely no side effects at all from it, and I'm looking forward to getting my second shot and being fully vaccinated next week.
Okay. And you never had to quarantine that I can recall.
No, I have not had COVID, thankfully, and I've not been a close contact of someone who had. And of course, I've been very, very careful. You know, I'm not wearing a mask at the moment because you're 6 feet away from me, but I wear a mask almost all the time, and individuals, when they meet with me, they do as well, and they stay more than 6 feet away. Because a number of individuals who work for me or who have visited with me have been determined to be positive, but once we looked into it, they were never a close contact.
Oh, okay. Lucky for you.
So I've been fortunate, but we've also been very careful.
Okay. Well, we got lots and lots of questions. I'd say more than 100 questions from our viewers and readers, and a lot of them sort of were similar, and they focused on, you know, when can I get my vaccine and when can I open my business? And you're probably used to answering that.
Yeah.
But let's start with Rudy of Baton Rouge, who says, why do you keep adding groups when the previous groups can't even get an appointment to have their first vaccine?
Well, the number of vaccines doses being made available has been increasing, and the Office of Public Health is engaging with our enrolled providers to determine if there's any slack in the appointment system. And as you determine that there's slack, then you can go ahead, and especially if you hear from Operation Warp Speed and the folks at the White House that the vaccine doses are going to increase, then we will add more groups. And I think it's been done about right. I mean, look, there's nothing perfect about our approach or anybody else's approach, and reasonable people can always disagree about certain things. But we believe we've hit the right mix, and we've gotten about 12% of our population to receive at least the first vaccine thus far. Puts us at the top tier of states, and we're vaccinating the right people because the overwhelming majority are for those who are 60 and above, which are the people most vulnerable to the disease.
Yeah, okay. Yeah, I thought we were above average, and maybe the storms put us back to average.
Well, the storm has impacted us.
Yeah.
So by Friday of this week, we will have gotten the vaccine that we were supposed to get last week, plus what we were supposed to be administering this week, and then early next week, we will get next week's doses. So over the next 10 to 14 days, we're going to be working extremely hard with all of our partners, our enrolled providers, to catch up, but we will be administering a lot of doses in order to do that.
Okay. This is from Melvin of Jefferson Parish. How does the state plan to roll out the vaccine as related to those working in education?
Yeah, well, we've already done that. So K through 12, and there's a difference in higher education. They are in a priority group, but we haven't yet gotten to their priority group. So is it early childhood and K through 12, teachers and all support workers, everybody who works on those campuses or those facilities is eligible currently. That was a change that became effective this past Monday. And they simply schedule an appointment with an enrolled provider, just like anyone else would, like you did, for example, and they go and they get their test. Now, they need to be able to show a pay stub or a credential issued by their school, you know, an ID badge or something, but they can get their vaccine now.
So they have to find their own appointment, but they're eligible.
And there may be some opportunities later on, because, you know, this first week, we're still suffering the effects of last week's storm and so forth.
Okay.
There may be some opportunities for some larger school districts to have some school-specific events, but teachers are eligible now. We don't have those school-specific events, and so I'm encouraging people to just call, find out which providers are enrolled in their area. You can get their phone numbers, their email addresses, and then you schedule your own appointment, just like others would, Peter.
Oh, okay. All right. So this is from Jonathan from Bossier City. He says, Governor, what guidelines and statistics is your office currently using to justify staying in Phase 2? Are we still in Phase 2? But we are still in Phase 2, but your own criteria doesn't support that. When will we quit moving the goalposts?
Well, first of all, the proclamation ends next Wednesday. It'll be replaced by another one. Obviously, we're not going to end the public health emergency. And we will make a decision on Monday of next week after a gating criteria meeting as to what we do. But I will tell you, we're certainly doing better. When you look at positivity, statewide, the average was 5%, exactly where it was last week. So it didn't go down again, but it's 5%, which is a third of what it was about 6 weeks ago. We have about a third as many people in the hospital as we did 6 weeks ago as well, and the lowest number since before Thanksgiving. And cases appear to be leveling off now and not decreasing any further, which is what we're seeing across the country. One of the challenges we're having in Louisiana is with Mardi Gras and the winter weather, testing has fallen off considerably, and so our visibility into exactly what's happening isn't quite what it was. But I anticipate, based on the data that I understand to be accurate as of the moment, that we will be making some changes with the proclamation that will be effective next Wednesday. I'm not going to make that announcement today, but I will tell you we've not moved goalposts. Our efforts have always been to try to be consistent with what the CDC and the White House Task Force is asking us to do, looking at the situation here in Louisiana. And I will tell you the last proclamation that expired did so just before Mardi Gras. And it would have been absolutely irresponsible to lift restrictions and mitigation measures ahead of Mardi Gras when you look at what happened Mardi Gras a year ago.
Right.
And the impact that had on our state, where we had the steepest incline in case growth anywhere in the world. So we'll look at doing that next week, and I'll have a decision that we will announce, I think, on Tuesday of next week.
Oh, okay. Well, that's good to know. Tell us, I mean, building on that question, what does the end of this look like to you?
You know,
and when is the end of this occur?
I'm not sure that there's going to be an end to COVID, just like every year you get a flu shot.
Yeah.
It is possible that for some period of time, and I don't know, I haven't, I don't know that the experts, the scientists and the epidemiologists have made a conclusion about this, but it's entirely possible, Peter, that you and I, for the rest of our lives, we're going to be getting an annual booster for COVID, just like people are supposed to get a flu shot. Yeah. And so, but now the end of the worst part of the pandemic, I really believe will happen for us sometime between mid and late summer and Labor Day. You know, in that time period, if you just look at when the vaccine is going to be available to general population, anybody who wants it can, I believe by June or so, will be able to go to their local pharmacy, to their doctor's office, whatever, and get the vaccine. And assuming that we have enough uptake, I genuinely believe that the worst of this is behind us by the time school takes in for the next school year in August. And I can't wait. I'm really ready to put this pandemic behind us, just like everybody else is.
Yeah. So it's plausible that over the summer, we will no longer be in phase anything, and there will be no public health emergency declarations, which I guess you keep having to issue them because they're only allowed to live for 4 weeks or something.
And of course, the federal government has had a public health emergency in place since last March as well. I think every state has. There's still a lot of work that you have to do, and if you don't have a declared emergency, then you can't fully participate in all of the programs and the funding from the federal government and use the National Guard to do. You know, I've got 1,000 National Guardsmen working COVID response today, and there's still an awful lot of work going on, and you know, we're looking forward, but I can tell you, we still have a few months where we have a lot of work to do.
Yeah. Okay, this comes from Baton Rouge, but they didn't fill in their name, and they say, I've postponed my wedding of 500 guests several times due to COVID. I understand and respect the restrictions, but is the end of gathering restrictions in sight, and when will I be able to hold my wedding? Now, do you want to be responsible for keeping these people from getting married?
Nope. But I can't today say when that's going to happen either. I mean, I'm not even prepared to announce what's going to come next Wednesday, plus, you know, much less whatever.
Let this guy have a wedding with 500 people.
And the other thing is, you know, and we've seen this recently, it's very difficult for me to make the decision to go backwards in terms of the phases and to reimpose restrictions that we've already lifted. But as I've mentioned before, anytime the capacity to deliver life-saving care in our hospitals is threatened, whether it's beds or staffing, we have to make changes in order to save people's lives. And I don't know, I don't have a crystal ball to know exactly what the situation is going to be like at any given time. But I believe that things are going to just steadily get better. The curveball out there is the UK variant, and I know that you're aware of that. But we have 18 confirmed cases in Louisiana, another 50 or so suspected, and what we know is that UK variant is all over our state and all over the country. Could be the dominant variant a month from now. And it's more easily transmitted, and it seems to be a little more severe if you get COVID from that particular variant.
Yeah, I see. Well, that's daunting. This comes from Joe of Baton Rouge. He says, why don't you try to enforce your mandates? If you won't, then please do us a favor and remove them immediately.
Well, first of all, we do enforce. The vast majority of our visits are compliance visits where we go out and just whether we're doing a check, a courtesy check, and advising them of what the current restrictions are. And if we find violations, we will talk to the business owners and the managers of those businesses. And almost always they come back into compliance. And as you can imagine, the typical violation would be employees and potentially customers not wearing a mask, or more often than not, having a mask, but just not having it up around their nose and mouth. But we have taken businesses that are persistent in their failure to have the proper mitigation in place or restrictions, or those who just refuse, and they have suffered consequences in terms of losing their licenses and that sort of thing. But it's really important, and I've said this from the very beginning, Peter, when you have 4.6 million people and tens of thousands of businesses and all these different venues, you really aren't going to enforce your way through that. Not every violation. I mean, it's just not possible. And so you try to do the best you can to educate people on the seriousness of the situation, to try to get them to understand that it is in their best interest as a business person to have a business where people feel safe going into, and have the general public to understand how important it is to be a good neighbor, wear their mask, prevent spread from other people, but also to derive the benefit that you can get for yourself by wearing a mask. And so we're going to continue to do that. And every time that we have increased our restrictions and we have actually been able to reduce transmission and get control over a surge, and we've had to do that 3 times now.
Yeah. What would you say to someone who owns a bar who said, you know, I can't run a bar where, you know, I'm allowed to open, but the positivity rate goes above 10%, then I have to lay off all my bartenders, and, you know, then 4 weeks later, the positivity rate goes under whatever, and I call my bartenders back, but they don't want to work. And I mean, what would you say to someone who owns a business who just says you can't operate a business like this?
Well, it's very unfortunate, and we have done everything that we can, consistent with public health, to try to give them as much leeway as possible to operate. Whether for those who have video poker machines, being able to keep 2 of those 3 machines on, for example, making sure that they can engage in delivery and drive-through and pick up, the flexibility that they have to operate outside, which is always safer than inside.
Yeah.
The ability, if they are able and want to operate as a restaurant with conditional license that we very quickly act on. But the simple fact of the matter is, bars are the venue that are most dangerous with respect to transmission because of the way people behave in bars. And it's not that I have anything against bar rooms. Nobody's trying to punish them. But we have a public health imperative to slow transmission. And you know, the recommendations on bars came from the CDC and the White House Task Force. When we do our own contact tracing, it reaffirms just how significant the threat is in bars. But once you get to a certain level, then we do feel like we are going to be able to reopen bars, and I'm hopeful that that day is coming sooner than later, not without restriction, but hopefully with restrictions that will allow them to all operate.
You mentioned contact tracing, which hasn't been as much in the news as when it was launched. Is that still working? And I remember initially the problem was nobody would answer the phone because they thought it was a junk call. And how much contact tracing are we still doing? And does it still, you know, what % of people are responding to it, if you know that?
Yeah, I don't have the most recent numbers, but I will tell you that we are still engaged in contact tracing. It remains a very important part of our overall effort. And we have had more compliance of late than we were getting earlier. We did have a problem with people answering the phone, and then some percentage of people who answer the phone don't want to reveal any information and so forth. But those numbers have been getting better. The other thing is that individuals can access help, because if they're being asked to quarantine or to isolate because of contact tracing, then we have programs in place to help them in terms of getting food to them and that sort of thing. And so it remains an important part of our effort going forward, and I'll try to get you the information from the most recent data that we have around contact tracing.
Okay, well, thank you. This is from Jason of New Orleans, and says, when are you going to let bars stay open past 11 p.m.? It's a very un-Louisiana thing to close bars.
Yeah, and you know, but that's really important. If you look at all of our neighbors, for example, I think it's a common 11 p.m. closing. You'll see it in Texas and Arkansas and Mississippi, and that may have just changed in the last couple of days, but I don't think it has. I'm unlikely to make that change anytime soon, and the reason is, let's compare bars and restaurants, for example. If you go out to a restaurant and eat a meal, you eat your meal, you go home, because you're only going to eat one meal, right?
Yeah.
But people who go to bars quite often go to multiple bars. If you leave them open all night, then you just have more people going to this venue, which happens to be most conducive to the spread of COVID, leaving that venue and then going somewhere else and starting it all over again. And so the 11 o'clock curfew has been a very, very important tool for us in terms of limiting the spread and making sure that those individuals don't inadvertently spread COVID more widely than they otherwise would.
Oh, okay. This comes from Joan of Baker, and she says, since the vaccine is now available for K through 12, what about college faculty members and staff?
Yeah, well, college folks are in the higher order of priority than the general population. We're not yet to the priority grouping that includes them. And I will tell you, there's a reason for that. If you look at what the CDC has come up with and so forth, K through 12 and early childhood education folks always in a higher priority, because at college age, the young people in the class are better able to keep their mask on. You don't have to be as close to them when you teach them. They're better able, if necessary, to learn online because they can navigate the computer and the Zoom and all that sort of thing. And then if for some reason that class needs to be canceled in college, you don't have to hire babysitters or stay home in order to take care of them. So the impact on the economy is not as great. So for all those reasons and others, K through 12 and early childhood people across the country have been at a higher priority than higher education. It's not to mean that higher education folks aren't a higher priority. And as more vaccine becomes available, and obviously we get a little deeper into the vaccination program, they will have access to it. And I can tell you the Board of Regents right now is actively surveying all of their systems and campuses to determine which of the faculty members want to avail themselves, and staff want to avail themselves, so that we can get a better figure on the numbers that's going to be required.
Okay. Cindy from Lafayette says, when will you allow us to visit our families in a nursing home? It's been almost a year. It's been a long, anguishing, heartbreaking time.
Nursing home visitation has been available for a long time, many months. And so
Cindy, I should call her nursing home.
I would just encourage you to call your nursing home.
Okay.
Now, if you have an outbreak at that particular nursing home, then there may be a short period of time when you can't visit.
Okay.
But there's been CMS came up with something months ago about a way to effectuate safe nursing home visitation. We adopted it immediately. And so I would just encourage Cindy to call her nursing home that she's interested in and schedule that visit. Now, that visit is likely to be outdoors and socially distanced and so forth. But nursing home visitation is open right now all across the state.
Okay. Robin from West Monroe says, why are family members of Louisiana National Guard soldiers not allowed at deployment ceremonies?
Well, you'd have to ask the Adjutant General and the folks at the National Guard, but I'm quite certain that has to do with COVID and not wanting individuals to get COVID as they are deploying overseas or to wherever they happen to be deployed to make sure that you don't inadvertently contract COVID, get sent away, and then have it circulate in the group of soldiers. So, and keeping those crowds out. Now, you know, but that's not a decision that I made. That the National Guard made that decision, and I'm sure that they made it with what they believe would be best interest of the soldiers and the mission and the family members, all because of COVID.
Yeah. So this is from Monique in Baton Rouge, who has the opposite view of most of our questioners, which is, why don't you revert back to phase 1 to protect more citizens?
Yeah, well, you know, I get that more often than you might think,
Really?
by the way.
Okay.
It's you know, reasonable people can always disagree. Are you going too fast and too far? Are you going too slow and not far enough? I will tell you that we base the decisions that I make on science, on gating criteria that have remained consistent from the beginning. And you take a special look at what's happening at any given point in time. So if you have a very large number of people in the hospital with COVID-19 and cases are increasing and hospitalizations are increasing, then obviously you're doing things different than if you have the opposite trajectory and so forth. And so I understand it's hard to make people happy, but at the end of the day, we're doing what we believe is most reasonable, trying to strike the right balance between protecting public health and saving lives on the one hand, with having as much economic activity on the other hand that you can have consistent with the public health imperative. And it's just, it's difficult. But you know, we're getting close to 10,000 people in Louisiana who've died from this disease. 426,000 confirmed positive cases. Now those are tests. And we know that there's more than that that's actually had COVID, because some percentage of folks are always going to be asymptomatic. They don't often test. Right. And so this has been a very, very significant public health emergency. And there are some people who you know, don't believe we should have in-person education going on right now and so forth. But we're doing the best we can to manage and strike the right balance.
A couple of thematic questions that came up, not related to vaccines and COVID. One was whether you have any reaction to the information that Les Miles settled a sexual harassment matter and what that says about the wider problems at LSU.
Yeah, well, you know, I think the story broke yesterday, and I don't know, from my understanding, LSU was not a party to the settlement, had no knowledge of it, and don't know what's in the agreement. I know that there's a dispute, so that the attorneys representing Coach Miles are saying that it's been mischaracterized. I mean, I just don't have enough information. Obviously, you're concerned anytime you hear about something like that. It was very surprising to me.
That was, you didn't know about it till yesterday?
No,
Okay.
I mean.
You weren't
no.
governor when it happened?
No, but I have never heard anything about that. And so it was obviously surprising, but I just don't know enough and I think to comment on it. And I think it would be irresponsible for me to kind of guess what might have been in there.
Okay. Another sort of thematic question that came up unrelated is there are various legislative efforts, and this may be what your meeting is fixing to be about this afternoon, related to reducing income tax rates and trying to find an alternative tax structure. Do you have any, any certainties or any concepts of what would have to be in it, in such a proposal, or what should not be in such a proposal?
Yeah, well, first of all, we are open to and support true tax reform. If you remember, the legislature a few years ago created a task force to study our tax system, other systems around the country, make recommendations, and we embraced just about every single measure that they came out with. Almost none of them passed, but they're all being recycled again now, and we can certainly support reform, but now reform means improvement.
Yeah.
And what is actually an improvement, I guess, is in the eye of the beholder. But can I support lowering income tax rates both for individuals and for businesses? Absolutely. And the easiest way to do that in a meaningful way is to eliminate the FIT, the deduction you get on state taxes for federal income taxes paid. Almost no states do that, and so you could be revenue neutral. So but you just have a much simpler system with lower rates, and you trade those deductions for the lower rate, and that's the sort of approach that the task force recommended. That is what we can and should do. Now, what I am not going to do as governor is create that structural deficit that I inherited again. We have worked too hard and made too much progress. You may have seen just recently Moody's improved our outlook to positive for the first time in a long time, citing the responsible way that we're managing the budget, and the fact that the revenues are coming in sufficient to pay the bills. I'm not going backwards on that, but anything that they want to do that is real reform and that is revenue neutral, I'm open to it.
Okay. One last question, because I said we would be finished for 12, and we will. Do you still have the chickens, and what happened to them in the cold?
I do have chickens, and they fared really well. Okay. They slowed down a little bit in the ultra cold weather, but this week they're back laying.
Do they not lay eggs in the cold weather?
Well, they will sometimes slow completely down and stop, but that didn't quite happen with us. Okay. But they're back laying eggs this week. In fact, I have them just about every morning for breakfast. But thank you for expressing interest in the chickens. They're doing well.
Okay. All right. Well, we appreciate it. I said we'd be through for 12, and we are through for 12, and we appreciate you coming out today, and thank you very much.